Hey everyone, getting ready for baby, right? It's such a huge milestone. But I know packing that hospital bag can feel a little daunting, especially the first time
Ah,
around.
for sure.
We're going to break it down for you today so you can walk into that hospital feeling,
Prepared.
yes,
Ugh,
confident and prepared, not stressed.
it's all about feeling good.
Right. No one needs extra stress when labor is about to start.
Right, exactly.
So let's jump right in mom's bag.
The all-important mom bag.
First things first. This is all about customizing.
It is, because
Right.
everyone's labor is different. Every woman's experience is
Yeah.
so unique. And, you might feel warm one minute, chilly the next. You never know how long it's going to last.
Right.
And you just want to have options.
Yeah, totally.
Yeah.
So what are some of the things that fall under that options category? Like what are the must-haves? I'm guessing comfy clothes, right?
Oh, yes, definitely.
You're like at the top of the list.
Loose pajamas or a nightie, something that is going to be comfortable. And also, think about breastfeeding. You want
Yeah.
something
Easy access.
easy access. Yeah.
Yeah.
Because those first few days, it can be a beautiful but challenging time.
For sure.
So supportive bras as well.
Yeah. Oh, for sure.
You're going to
All the comfort you can get.
Yeah, all the support you can get.
Totally, totally. Okay, so comfy clothes, check it. What about toiletries? I mean,
Oh, yeah.
I'm guessing it's not about,
Not a full spa day.
no, not a full spa day, but just
Right.
feeling fresh.
Yeah, you want to feel human.
Yeah.
So, the basics, your toothbrush, toothpaste, face wash, lotion, whatever makes you feel
Yeah.
clean and refreshed.
Yeah. And lip balm.
Oh, yes, lip balm.
Hospital air is so dry.
And labor is dehydrating.
Very dehydrating.
So, yeah, good tip.
Yeah.
Lip balm. Okay, before we move on to the partner's bag, I do want to touch on something that's, I think, really important, and that is the birth plan.
Yes.
Like, we're talking about the physical stuff to pack,
Hmm.
but this is a really key part of preparation.
Yeah, of the whole thing.
And this is so easy to forget about, when you're
Yeah.
worried about packing your bags.
Yes.
But taking the time to think through those preferences
Yes.
for labor and delivery is so important.
So for first-time parents, what exactly is a birth plan?
Okay, so it's essentially like a roadmap.
Okay.
It outlines your wishes, your preferences for how you want your labor and delivery to go.
Yeah.
It covers things like, do you want pain medication?
Right.
What positions are you hoping to labor in? Who do you want in the room with you? And then even things like, skin-to-skin contact right after birth or delayed cord clamping.
Okay, so it's not just about the medical side.
No.
It's about the whole environment and the experience.
Yes, it's about having that sense of control
Right.
during a time that can often feel very out of control.
Yes, and communicating that with your medical team.
Exactly.
So everyone's on the same page.
Yes, absolutely.
Okay, so how do you make a birth plan? Like, is there a template? Where do you even start?
Yeah, there's tons of resources online. You can even get them through your doctor.
Okay.
But the most important thing is to talk to your doctor or your midwife
Yeah.
about what's important to you,
Right.
what your preferences are, and what's realistic.
Right, because every birth is different.
Exactly.
Every situation.
And things change.
Yeah, so it's not set in stone.
Not at all.
It's just a guide.
It's a guide, yeah.
Okay, perfect.
The goal is to have a positive experience, however that ends up looking for you.
Exactly. Love that.
Oh,
Okay, so let's switch gears and talk about the partner's bag.
okay.
Because they may not be giving birth,
No.
but their role is huge.
Oh, massive.
So what are some things partners should be thinking about packing?
Well, again, comfort is key.
Okay.
So change of clothes, toiletries,
Yeah.
something comfy to sleep in because...
Hospital beds are not always the most comfortable.
Exactly.
Yeah.
And a sweater.
Oh, yeah.
Hospital temperatures?
You never know.
You never know.
Right.
So yeah, be prepared.
And snacks.
Oh, yeah.
Right.
Yeah, absolutely.
You got to keep your energy up.
You're going to be there a while, potentially.
Totally.
So yeah, some energy bars, nuts,
Yeah.
flute, anything.
Okay, so we've got the essentials.
Yeah.
What about entertainment?
Oh, the entertainment, or should we say distraction?
Right.
Yeah, labor, it can be intense, but it's not always intense, right?
There were downtimes.
Different downtimes.
Yeah.
So having a book,
Yeah.
magazines, even a tablet, to watch movies or play games,
Yeah, just something to keep you occupied.
to keep you occupied, create that nice,
Yeah.
calm atmosphere.
Because you're not just a spectator. Right.
No, you're an active participant.
You're there to support.
Exactly.
So true. So true. Okay, we've got mom's bag. We've got the partner's bag. What about start of the show?
Oh, the baby.
What about baby's bag?
Yes.
What do we need to pack for a baby?
Well, this is where it gets interesting. You actually don't need that much for baby.
Wait, really?
Yeah, the hospital.
I thought it was going to be like the biggest bag full of all the gadgets.
But yeah, the hospital's going to have most of what you need
Okay.
in those first few days. They'll have diapers, wipes, formula if you need it.
Okay.
They even have like basic clothes. So really what you need to pack for baby is just their going home outfit.
Okay, so one outfit.
Yeah, just one cute little outfit.
Yeah.
Something comfy that's
Wow.
easy to get on and off.
Makes sense. Makes sense.
And then maybe a receiving blanket
Okay.
to swaddle them and keep them nice and cozy.
Yeah.
And depending on the weather, you know, a hat, some mittens.
Okay, so it's really just the basics.
It's just the basics.
And I've heard that advice too, just to not go overboard
Yeah.
with the newborn size clothes.
They grow so fast.
They grow so fast.
You'll be surprised
Yeah,
how quickly they'll be out of those newborn clothes.
totally, totally. Okay, so we've got mom's bag, partner's bag, and baby's bag. Is there anything else that we should be thinking about?
Well, you know, there are a few extra things that can just make your hospital stay
Yeah.
a little bit smoother and more comfortable.
Yeah.
Like, think about packing a small fan,
Oh, good idea.
especially if you're giving birth during the summer.
Yeah,
Hospitals can be stuffy,
totally.
and a fan can be so nice.
So nice. Just those little comforts,
Exactly.
right?
Yeah.
Like your favorite pillow, a cozy blanket,
Yes.
a book to read,
Yeah, just those things that make you feel...
like yourself.
Yes, exactly.
Yeah, a little bit of normalcy
The normalcy, yeah.
and all the chaos.
Yeah, amidst all the excitement.
So, okay, we've got our bags packed. Now what? Like, what happens when we get to the hospital?
Okay, so you arrive at the hospital.
Yeah?
You're going to take a deep breath.
Okay.
You're in good hands.
Yeah.
They're going to take you to an area called triage.
Okay.
And this is where they're going to assess how your labor is progressing. Okay.
Check your vital signs
Mm-hmm.
and figure out what the next steps are.
Okay, so it's not always an immediate,
Yeah.
straight to the delivery room.
Not always.
Okay.
Sometimes you'll go straight to the delivery suite.
Okay.
Sometimes they'll want to monitor you for a little bit.
Okay.
Sometimes they might even send you home
Oh, wow.
if labor hasn't progressed enough.
Okay, so it's really about
Yeah.
managing those expectations.
Exactly.
Yeah.
And making sure you're getting
Yeah.
the right care at the right time.
Okay, I love that.
Yeah.
Managing those expectations. I think
Yeah.
that's a really good point. So
Yeah.
once you're settled in, then the real journey begins.
Then the fun starts.
All right, so I think we've covered a lot
Yeah.
of ground here. But I think before we move on
Okay.
to talking about labor and delivery,
Yeah.
I think we should take a quick pause.
Sounds
And
good.
we'll be back in a jiffy to delve a little deeper
Okay.
into what to expect in the delivery suite.
Okay, great. And those first few hours with your newborn.
Perfect. I'll see you soon.
See you soon.
Bye.
Okay, so we're back and we're ready to talk about labor and delivery,
The main event.
the main event.
Yeah.
I know this is a part that can feel a little intimidating for first-time parents especially.
Yeah.
Like,
Or...
What's going to happen?
Yeah.
So let's talk about what to expect once you're settled into the delivery suite.
Okay.
I know there's a lot of monitoring going on.
Yes, there is.
Can you kind of walk us through that a little bit?
Absolutely. So monitoring is key to make sure that both mom and baby are doing well
Right.
throughout labor.
Okay.
So they'll be checking your vital signs regularly, blood pressure, temperature, pulse.
Mm-hmm.
And then they'll also be using the special device called a cardiotocograph
Okay.
to monitor baby's heart rate and the frequency and intensity of your contractions.
Oh, okay. Yeah, I've heard about those things. They put a sensor on your belly, right?
Yes, they do.
Is that safe?
It's completely safe, yeah.
Ugh.
It's painless.
Mm.
You might hear like a constant beeping sound,
Yeah.
but don't worry, that's normal. It's just the machine doing its job.
Okay.
And usually you can even adjust the volume if it gets to be too much.
Okay, good to know. Good to know.
Yeah.
Okay, so let's talk about pain management because I know this is a big one for a lot of expectant parents.
Yeah, for sure.
What are some of the options?
So there's a wide range of options.
Okay.
From, natural pain management techniques to medical interventions.
Okay.
Some women find relief through breathing exercises, meditation, or even like hydrotherapy laboring in a warm tub.
Oh, wow.
Yeah.
That sounds nice.
Yeah. And then other women opt for pain medication, like an epidural, which numbs the lower half of your body.
Yeah, I've heard that those are pretty common.
They are, yes.
So how do those work?
So an epidural is a type of regional anesthesia,
Okay.
and it's injected into the space around your spinal cord.
Mm-hmm.
And what it does is it blocks pain signals from traveling to your brain. So you won't feel contractions in the lower part of your body.
So you're still aware of what's going on, but you don't feel the pain.
Exactly. Yeah. It can be a really great option for women who want pain relief but still want to be awake and alert
Right, right.
during labor.
Okay, so there's lots of different approaches to pain management. How do you know what's right for you?
It's a very personal decision.
Yeah.
There's no right or wrong answer.
Right.
So the best thing you can do is talk to your doctor
Yeah, right.
or midwife
Yeah.
about your preferences and any concerns you have, and they can help you weigh the pros and cons
Yeah.
of each option and come up with a plan that feels good for you.
Yeah, and remember, it's okay to change your mind.
Absolutely.
Right. During labor. Like,
Yeah.
your needs might evolve.
Yeah, exactly.
And that's totally normal.
It's all about flexibility.
Flexibility, yeah.
Okay.
Good to know.
Yeah. Now, aside from pain management, there might be other procedures or medications
Okay.
used during labor. So, for instance, your doctor might suggest an amniotomy,
Okay.
and that's when they artificially rupture your amniotic sac.
Oh, okay. Whereas they say, break your water.
Yes, exactly. Break your water.
Why would they do that?
Sometimes, if labor is progressing slowly,
Okay.
breaking your water can help speed things along.
Okay.
It's a quick procedure,
Okay.
generally painless.
Okay. Interesting. Interesting. And then what about, I know sometimes they use medications to strengthen contractions.
Yes.
What are those called?
Those are called oxytocics,
Okay.
and they're synthetic hormones that mimic the naturally occurring hormone oxytocin, which plays a key role in labor contractions.
Okay.
So they can be helpful if your contractions aren't strong enough
Okay.
to dilate your cervix effectively.
Okay. So it's really all about making sure labor is progressing
Exactly, yeah.
smoothly and safely.
Smoothly and safely, that's the goal.
Okay, great.
Yeah.
Now, let's fast forward a little bit to the pushing stage.
Okay.
Because I know this is when things get really intense,
It does.
both physically and emotionally,
Yes,
but also super empowering.
it is, yeah.
So what are some tips for navigating this stage of labor?
Well, your medical team is going to be there to guide you every step of the way.
Okay.
They'll help you find comfortable positions, teach you how to push effectively,
Yeah.
and your partner can provide invaluable support here.
Yeah.
Holding your hand, offering words of encouragement, reminding you to breathe.
It's a real team effort.
It is. It's a team effort for sure.
Totally.
And then, after all that hard work, comes the most magical moment of all, the arrival of your little one.
I can only imagine.
It's truly indescribable.
Yeah.
And once baby's born, the journey's not over.
Right.
There's still so much to experience in
Yeah.
those first few hours after birth.
Okay. Well, before we get to those first few moments, let's take a quick pause
Okay.
and we'll come back for part 3.
Okay.
We'll delve deeper into postpartum care,
Right.
breastfeeding, and those crucial first few days
Sounds great.
at home with your newborn.
See you then.
See you then. We're back. So we've talked all about prepping for the hospital, the labor and delivery.
Yep.
Now, what about
Now what?
after baby comes? Postpartum, the first feedings, that whole new world.
It's the big one.
Yeah, huge. Okay, so let's start with physical recovery for mom.
Okay.
I know there's bleeding after delivery. Is that like basically a super heavy period?
Yeah, it's called lochia.
Okay.
It's vaginal bleeding, and it'll last for a few weeks. It starts off bright red
Okay.
and then gradually lightens over time.
Okay.
And you might also experience some after pains,
Okay.
which are basically contractions.
Oh, really?
Yeah, they help your uterus shrink back down.
Oh, so it's still working.
Still working, yeah.
Oh, wow.
They can feel like mild period cramp.
Okay, so I'm guessing comfort is key.
Oh, definitely.
Right.
Rest, stay hydrated,
Yeah.
good food.
Nourishment. Yeah. And I guess asking for help.
Yes, absolutely.
Clearly.
Don't be afraid to
Right.
delegate those chores and those meals.
Yeah, let someone else handle that stuff while you're
Yeah,
recovering and bonding with the baby.
exactly.
Speaking of bonding, what about those first feedings? I mean, whether you're breastfeeding or formula feeding, I imagine there's a learning curve there
Huge learning curve
for both of you.
for both mom and baby. Yeah, it's a dance.
Yeah.
And it takes practice and patience.
So true.
Especially with breastfeeding, those first latches can be tricky.
Yeah.
But the nurses are amazing.
Yeah, that's what I've heard.
They're such a great resource. They can help you find comfortable positions and make sure that baby's latching on correctly.
Yeah. Okay. And if breastfeeding isn't working or you choose not to, formula is totally fine.
Oh, absolutely.
Fed is best.
Fed is best, yep. You got to do what feels right for you and for your family.
Yeah, for sure. For sure. Okay, so you're home now
Oh, home sweet home.
with this Tiny human.
Tiny human.
It's got to feel a little overwhelming.
Oh,
So any tips for that transition?
well, the biggest tip I can give you is patience. You know, newborns are demanding, let's be honest.
They are.
You're going to be adjusting to this whole new routine or lack thereof.
Right, right.
So embrace the chaos.
I love that. Embrace the chaos.
Yeah.
That's kind of parenting in a nutshell, right?
Yes, pretty much.
Yeah.
And remember, it's okay to ask for help.
Oh, yeah, don't try to do it all.
Don't try to do it all.
Right. You're not superhuman.
No, you're human. You're learning as you go.
So true.
There's no such thing as a perfect parent. You just do your best, you trust your instincts, and you give yourself grace.
Love that.
And remember, those first few days are full of precious moments.
Yeah.
Even amidst all the sleep deprivation and the diaper changes.
Yeah, it goes by so fast.
It does.
Okay, so speaking of things that change quickly,
Yeah.
postpartum emotions.
Oh, the emotions.
Right, you've got hormones fluctuating, sleep deprivation,
Yeah.
huge life-changing. It's got to
Yeah.
be like an emotional roller coaster.
It is. It is. And it's normal to feel all those things. From the joy, the elation, to the anxiety, and even sadness.
No, it's okay to talk about it.
Oh, it's so important.
Yeah, don't keep it bottled up.
Yeah, talk to your partner, a friend, a family member, or even a therapist if you need to.
Yes, having that support system is crucial.
It is crucial.
And partners, that goes for you too,
yes.
right? Like be there to
Oh,
support.
that emotional support. Yeah.
Help with baby care.
Be present.
Just listen.
Just listen.
Yeah.
Don't judge.
You're a team.
You are a team now more than ever.
Yeah, those early days, they're intense.
They're intense, but they're fleeting.
They're fleeting.
They go by so fast.
And before you know it,
You'll be finding your groove.
yeah,
You'll be settling into your new life.
as a family.
As a family.
Okay, I love that.
Yeah.
I think that's a great place to wrap up our deep dive.
I think so too.
We've covered so much.
Yeah.
From the hospital bag,
Yeah.
labor and delivery, postpartum recovery,
Yeah.
those first days at home.
Those first days,
So hopefully you're feeling more prepared.
more prepared.
Confident.
Confident.
As you embark on this amazing journey of parenthood.
It's quite a journey.
It is.
Remember, every journey's unique.
Yeah.
Embrace the adventure. Trust your instincts.
Yeah.
Ask for help when you need it.
So important.
Yeah.
And cherish those moments.
Cherish them.
They go by so fast.
They do.
Well, thank you so much for joining us
Yes, thank you.
for this deep dive.
It's been a pleasure.
We'll see you next time.